your friendly family physician. Today's episode is for any expecting parents or anyone who's just become a new parent, because I'm here to teach you about 4 things that happen in the postpartum phase to almost actually every woman who gives birth. So if you're in any of these categories, this video is absolutely for you. The purpose is to try to teach you and empower you so that you are better prepared for these really difficult changes and things that happen. Before we get into it, if you like my channel, if you're learning something from it, please subscribe and send it to someone that you love and know can learn something from it as well. Some call it the 4th trimester, and it sort of is in a way. You know, there's the 3 trimesters where you're actually pregnant, and then there's this whole transitional phase, which is what I like to call it, where your body and your mental state is completely evolving and adapting to this new human who's in your life. Congratulations! Now, on top of all the fun, feeding, regurgitation, colic, sleep regression, no sleep, and all these fun things, there are these 4 common things that happen to all women who give birth. 1 has to do with breast engorgement. So whether you breastfeed or not, this will tend to happen. The other is a question of hot flashes. Doesn't happen to the same extent to everyone, but it will happen. 3 is the question of returning of normal menstruation. And 4 is the postpartum bleeding, which will happen in all women, but to various degrees, intensities, and duration. I'm going to be speaking to you from the standpoint of a physician, but also from a patient or an experienced mother who's already been through this postpartum phase. I know very well that these 4 topics tend to never be discussed at the prenatal appointments. So people feel very underprepared. And even as a new mother, even though I had trained as a physician, I wasn't so aware about all of these things. And it helped a lot for myself to research on them and to learn about them more in detail. So here I am sharing with you so that you're better prepared when your time arrives. Okay, so issue number 1, I will say issue because they are issues and you have to deal with them, are what we call hot flashes or night sweats. I'll put them in that category because it's essentially that you start sweating profusely and there's no real explanation. You don't necessarily have fever. Again, it happens to women at varying intensities, but I can explain to you maybe also from my experience what it was like and also what we did about it. So why does it happen? It tends to happen the first few days postpartum, up to the first couple of weeks. It should not be lasting longer than that. There's a few theories. Number 1, there's a whole thermoregulatory dysfunction. So basically your body not knowing how to regulate its own temperature because of all the hormonal changes. Number 2, the theory of decreased estrogen. So when the placenta leaves your body, there's a big chunk of estrogen leaving and hence a drop. This may be why the sweats happen. And then finally, the elevated levels of prolactin, which is a hormone that helps you produce milk, suppresses estrogen. Another reason why you would have these hot flashes. Now, because they tend to happen mostly at night, I don't know why, some of the things I found helpful for myself were 1, wear loose clothes as much as possible, or none, but not wearing a bra can be very uncomfortable, so loose clothes. 2, whatever you choose to wear, cotton ideally, silk, satin, it's gonna get all wet and soaked and not dry up easily. Next, I would also have a towel underneath you so it could soak up as much of that sweat as possible. Another tip is to have powder on your bed so it could absorb some of that sweat. Obviously change the sheets the next day because you'll definitely need to. And finally, hydrate. Because you're sweating profusely and it's insensible water loss. It's not like when you urinate, it's just happening without your control. You need to rehydrate extra because of that loss of hydration. So you should not spike a fever. You may have a low-grade fever and that could be normal, but it should pass and not persist. If something like that is persisting, then you need to consult. That's all I got to say about hot flashes. They suck. They don't last long. These are the ways to manage them. Next thing to talk about are breast engorgement. So like I said, this applies to women who breastfeed as much as those who don't. Why? Because naturally the breasts are going to fill with milk in the first 24 to 72 hours. Even if you let down and don't end up using it, it will engorge. So there's kind of like a progression of this. There could be breast engorgement, which is normal swelling of the breast of milk passes on its own typically. Blocked ducts, which are when the breast milk ducts get full in and of itself. So specifically be one breast, not both. And then finally, the transition into something called mastitis, which is an infection of these blocked milk ducts. So when one is not treated and it progresses to the next, you may end up in what is called a mastitis, a breast infection. And I'll talk to you about how we go about treating it at every phase so that we can avoid that infectious process altogether. Now, like I said, the first engorgement phase happens within the first 24 to 72 hours. You may either choose to breastfeed or not. Whatever is the case, you will want things to help alleviate the pain and swelling of these tender, large breasts. This happens to be more intense for women with smaller size breasts just because the capacity for milk storage is less than those with larger breasts. But again, this can affect any woman at any breast size. Why it happens is because the supply is greater than what is being removed, right? Either through pumping, through breastfeeding, or just manual extraction, if you will. Also, as I said, this typically spontaneously resolves. But if you are in pain and there is tenderness, here are some things you could do. Number one, if you are breastfeeding especially, let the breast be under warm water prior to breastfeeding. It'll help loosen the milk and the ducts before the flow of the breastfeeding or pumping, and that will help it come out much more easily. Next is, especially after feeding, cold compresses. So after you've helped loosen it, you've fed or pumped or whatever extracted, then you want to put cold compresses on the breast to help basically as an analgesia. You don't want pain. Other than the compresses, the hot, you can do a massage. So this is more not just for the engorgement, but when you feel a blocked duct, which you feel tenderness in a very specific area of a very specific breast, generally it's one-sided. You'll feel the blocked duct. It'll be, like I said, very localized of the breast. There'll be a specific area. You can massage it. Again, nothing crazy, but under hot water, massaging it will help loosen that blocked duct. Also, especially prior to feeding or pumping or whatever. The other thing you could take is an analgesic, Tylenol or ibuprofen if you have no contraindications. It's not dangerous to do this while breastfeeding, and it will help bring down the pain and the swelling. The other thing a lot of people are afraid to do or hesitate is to breastfeed on the side of the pain. But in fact, that's one of the treatments, is in order to help empty that duct or that breast, is by breastfeeding more so on that side. That doesn't mean neglect the other side, because then you might have, the same problem, but always start feeding the child, the newborn, on the side that's blocked to help empty it as much as possible before progressing or proceeding to the other side. Things you want to try are focus on your latch. Make sure that's not a concern. If it is, try to consult with a lactation consultant. Look at, you'll get an evaluation for your child's latch and all the things that come with that. That's its own topic in and of itself. Try to extract either manually or with a pump. And lastly, something that will help empty these ducts is gravity. So because of the position when you breastfeed, it's not necessarily ideal in order to release the milk throughout the whole breast. And if you're on all fours, you'll feel like a cow. The milk will kind of let down much better and equally distributed from all the ducts. Something to consider. Now, if we're in trouble zone and no matter all these things you've tried, you're still really sore, there's possibly erythema or redness on a specific area of the breast, which is really tender, and you spike a fever, at that time you should consult. And fever is over 38 degrees Celsius. You should consult with the healthcare provider so they can evaluate you properly in order to decide whether you need an antibiotic treatment or not. I see this very commonly. Like I said, it's not rare. It could be a question of hours where a blocked duct is not treated adequately and it ends up infecting the breast. And in that case, a woman simply needs antibiotics, a full course, 7 to 10 days, and that will do the trick. So never hesitate if you're getting to that point and it's hurting too much or you're spiking a fever or it's really red and tender, simply consult. The takeaway message, however, is never to stop breastfeeding on the side that is tender or swollen or possibly infected. Now we're going to talk about the resumption of normal regular menstruation. We know that after you've given birth, your sex steroid hormones are all super low, especially because your prolactin is high. You tend to have suppression of your gonadotropin hormone, which is an endocrinological explanation for why you don't have a period. You're not ovulating, especially regularly, at every month. Now, this is directly linked to the intensity of breastfeeding. So a woman who does not breastfeed at all should resume her period within the first couple of months postpartum. Someone who does breastfeed, whether exclusively or not, will have a resumption of her period at varying phases. So it's hard to say which women will have their period at which month. It is incredibly variable, I could tell you that. But if you do exclusively breastfeed, it is 40% of women who will not have a period for the first 6 months postpartum. Again, exclusively breastfeeding, meaning not giving any formula, and everything comes from their body. That means the intensity is quite high of the breastfeeding. This in mind, although you're not ovulating or visibly bleeding, does not mean that it could be used as a source of contraception, because countless patients that I have met got pregnant while breastfeeding, even exclusively. So keep that as a takeaway message if you don't want to get pregnant again. And if you don't mind and you want to get pregnant again then it's all good. Don't use protection. But if you don't want to get pregnant again, then this is a time to speak to your doctor about some kind of backup barrier protection, barrier or not. So either condoms or contraceptives, otherwise IUDs, pills. There are plenty of options, even in the postpartum phase. And then once you do get your first period, well, you'll know you're ovulating, and it may still be irregular or infrequent if you're breastfeeding. Once you stop breastfeeding, however, you should have resumed your period within plus or minus 3 months. If you've stopped completely breastfeeding, not gotten your period for about 3 months, that's when you should consult a doctor to look into other causes. Thyroid, anemia, malnutrition. There are many causes for why you will not have resumed your period, and it's something to look into, again, if you've not resumed. But there's no cut line. It's variable per female, hormone levels, breastfeeding or not. All of these things can affect nutrition. Like I said, also someone who is inadequately getting sources of nutrition, breastfeeding or not, their period will be delayed as well. So again, if you have doubts, seek advice. Early on, it's very typical and normal not to have a period. And if you're exclusively breastfeeding, even up to a year, you may not see a period at all. Now, final thing we're going to talk about in the postpartum phase is bleeding. All women will bleed in the postpartum phase after you've delivered the fetus and the placenta. There's something called the decidua, which is a lining of your uterus, which is shedding the first couple of weeks. Now, it's very typical the first 2 to 3 weeks to still have bleeding. It's called lochia rubra, which is the bright red blood, kind of like a normal period for the first couple of weeks. Could be 1 week in some women, could be 3 weeks in some women. And then it'll change to lochia rubra, which are Latin term, serosa, for faint pinkish, brownish bleeding or discharge, which could last a couple weeks more. Now, 15% of women will still be bleeding up until 8 weeks postpartum. This is normal, but again, by 2 months postpartum, you typically are no longer bleeding. That's why by your 6-week postpartum visit, most women are no longer bleeding. And if you are bleeding or bleeding heavily or heavier from day to day, this is completely not normal, and you should consult even sooner. There's something called postpartum hemorrhage, which nurses and physicians look out for in that first 24 to 48 hours postpartum when you're still in the hospital, typically, and that should be caught earlier. But if ever you get home and the bleeding starts becoming heavier, not normal, it should be going down, and you may be experiencing postpartum hemorrhage, a complication of a laceration, an infection, something not normal happening, and you don't want to wait till you're in the danger zone. So go get it checked sooner than later. Those are the 4 things I wanted to cover. I hope you all learned something from this today. I know it gets bloody and messy and painful and dirty, but not to say that the beauty of the postpartum phase also does exist. These are tough moments. It's a huge transition for anyone, and no matter how many kids you've had, whether this is your first pregnancy or your 10th, it's a lot of adapting. It's a lot of things happening to you physically, mentally, and emotionally as a new parent or new mom, or, just your body. So yeah, give yourself the grace to adapt, to get used to it, to deal with it. Don't put so much pressure on yourself. Do what you gotta do. If that means not breastfeeding, if that means taking some medication, do what you gotta do. No hard feelings. Like, no one should feel guilty about these things, because I notice that a lot of people tend to feel guilty, and you shouldn't, because this is already a hard phase in and of itself. But I hope you learned something, and I hope this gave you a bit more tools to help prepare you for that postpartum phase, other than all the other things that people, want to do and have and prepare for, be it a crib, be it the right clothing. These are kind of the things you'll need to know about immediately so that you can manage them before they get complex or dangerous or complicated for your health or the health of your baby, depending on how available you are to them. That is all. Wishing you all a wonderful morning, afternoon, evening, whenever you're watching this, and a wonderful new parenthood journey. All the best, and see you at my next episode. Don't forget to subscribe, and see you soon.